services, because you well know a person who does not talk, of course, can't speak anything. They will just use sign language. And for you as well, you also don't know the sign language, so you can't interpret what they want. You get, so that will make the issue hard. Um, then inadequate services. Find everything might be well, and then you go to a health facility, but then you find there are no services, like there are no tablets, there are no condoms. So that is a limitation, because your reason for going to the health facility is to get a condom that you use to protect yourself from HIV, but then you don't find it there. Of course, when you go back home without it, you go live and then you contract. Discrimination. This is among the disabled people, and then some other groups of people like the albinos. These people are normally discriminated by people, by different people. You know, when someone is discriminated, it makes you lose that esteem, and when you lose the esteem, you can't stand in front of someone and you can't confront them and tell them what you want. Of course, you will stand back and feel like, no, I want to be listened, just like the community treats you like every time. So it will be hard for you to go and tell a health worker that maybe I was exposed to HIV, I need PrEP. You won't be able to do that because you lack that self-esteem, you lack that confidence in yourself. Then the professional ethics. Some health workers lack professional ethics, whereby I can go tell a secret. Okay, to me it is a secret, but to them it's normal. So you go and tell them, I had maybe sex last night with someone that I wasn't sure of their status, and so I need this and that. Or you can tell them that maybe I'm feeling some kind of itching. I need treatment. I don't know what's happening to me, and really need help. And then before even you get out of the hospital, you find that almost everyone in the hospital knows that your thing is itching. You get that's confidentiality breach. So some health workers don't have confidentiality. That makes us like fear, because if I come and tell you my problem, it is a secret to me. I want it to be between me and you, and then you tell it to the whole hospital. I'll feel bad and I'll feel out of place in that area. Then the public myths. You very well know these public myths, and many adolescents really believe in them. That when you go before having sex, that you wash your private parts with cooking oil or with soda that you don't contract. You very well know that these things are there in the community and people really follow them. So these things are a very big limitation to adolescents or anyone ignorant to receiving the services that they really need. Because if I feel like Coca-Cola will work for me, why would I come for a condom? You get? Are you getting? Yes. Then forwards to the hard to reach areas like the hilly areas and the mountainous areas. You all know that these areas they're very risky, and it is hard to construct roads there. So ambulances rarely. Okay, like it is very hard for ambulances to reach there. You know, rocks fall, there are no roads, they're very slippery. So even these workers fear to go there, and that also makes it hard to like it is hard to find a health facility. I also bring in this point to explain it in the same way. Like inadequate health facilities in some areas, it is also like the health facilities. It is hard to find a health facility in hilly areas because, first and foremost, there are very few people who live in such areas, and it is hard to access them, the roads and all that. So this is also a limitation to receiving these services. Thank you for listening.
Having HIV is not the end of the world, but also those who are negative, especially us, the young people, the adolescent girls, we need to support those who are HIV positive. For us to love them, to support them, because some of the HIV infected young girls and adolescents, why they stop taking ARVs, or they hide and not want to say that they are HIV is positive is because of how they see us, how we discriminate. How we discriminate them. You don't eat from the same plate. You don't want to sleep in the same room. If they're in the class, you don't want to be their friends, you know. We need to support each other, especially supporting those who are HIV positive. And by the way, being HIV positive, we have seen people who even live longer than those who are HIV negative. See, Checho? We have seen them, people living over 30 years. So we need to take away, among the things we have learned, how to prevent ourselves from HIV, getting HIV as young girls. We need to come out as one, as knowing that we don't need to stigmatize. Stigmatizing meaning okusosola. Omuntu oyo gw'olabye nti alina red lips, it may not be that they have HIV. They may be having another disease, but even when they have HIV, it is not the end of the world. So let's learn to love. Let's learn to accept that this is part of us. They're part of our people. They don't have a different color. They have the same blood. We need to love and respect them. We don't need to stigmatize them, okay? Yeah.
To prevent yourself from getting that HIV, and you don't know that I have HIV, but you're now taking PrEP to prevent her HIV. So my question there, can PrEP also work as best? Because in that scenario, you don't have HIV, but you're going to take PrEP, and your main issue is to prevent yourself from contracting HIV. Do you get, before the 90 days, before that thing shows? Of course, you can't wait. The PrEP will have to work within the 72 hours. But today you slept with me, and then the next morning you're taking PrEP to prevent getting this one's HIV. You're still within the 72 hours. So how can you go about it? Can you, because you're going to take PrEP to prevent this one's thing, but you're already exposed to mine. So how will you go?
Or both of them. Commercial sex workers. Do they use PrEP or both of them combined?
So now people have manifest accept, like for example, if me, I know this is my business, I need to be safe, okay? I enroll on PrEP, okay? So that I'll be taking it. But also that those female sex workers, like for them, they are not enrolled on what? On PrEP, okay? And the person that slept with, maybe for them they have been using condoms, but maybe they got this client, okay, who refused to use a condom, and they're thinking this client must not be safe. Of course, I'm going to go for PrEP now. I think it. But the best idea is to is for them to enroll on what? On PrEP. Okay? On PrEP. Because this one will be taking it, and at least there you have some guarantee that even if I miss, even if maybe I get in touch with somebody whom I don't trust, I'm safe. I'm getting it. But also I say, don't only rely on that PrEP. Use it with another. For you to be 100% sure that I'm protecting myself, never use only one method. Okay? You're using PrEP, add the condom at least. Okay? So guys, our tea is ready. I want to first pause here, and we shall come back and finish. I think I have like more 3 slides.
Sometimes maybe I've used a piercing object and it has pierced me, maybe I've put it somewhere. Then my baby puts maybe over pierces himself with it, and it's still maybe under 1 year. 8 months, 6, 7. Can I, if I realize that he has pierced himself with an infected object, can I run for paper and I give it to him at that age of his?
And for the HIV, there is a way the HIV virus acts. That virus, it doesn't survive outside the blood for more than 10 seconds. Are you together? It doesn't survive outside the blood. For example, if I pierce myself now, I put it here, after 10 seconds, the virus will have died. But I don't want us to take risks. I get in it. And because Peter said after 10 seconds we die, let me pierce, then I was, both guys are fine. They can also pierce the baby now. I say no, just to prove. But why should you take those chances? So if you have just pierced yourself, and this has also just pierced him or herself, the first thing you do is you rush to the health facility. Because some of the things have them with oral suspension for kids. You know, kids sometimes they can't take their drugs. But of course, the regular will advise you better. I want you to know that every drug will have the resources that you will have those for the children. Okay? Likewise, who has ever seen other drug for the babies? You have other drugs for the babies. But do you know that? Hey, you have other drugs for the baby and oral suspension. I get it. So that is it. We had another question.
Is it all? Can it also be used to prevent HIV? And this is an inquiry.
Yes,
Okay, I don't know. Maybe I'm also speaking on behalf of some other people here who haven't gotten that chance to look at the ARVs. So I'm just inquiring. Maybe after the session or during the session, we can get a chance to see the ARVs, their packaging and all that, because you may get a chance, God may help you somewhere somehow, and then you go to someone's place or you meet with someone, and then you find those drugs somewhere, but you can't know the ARVs. But if you know them, you can quickly quit. But also not. Thank you so much, sir. My name is Kayaga Vanessa Mtevi. I'm a youth in MBALE district, and some of the barriers to access of HIV-related services among the adolescents are, I'll start with discrimination. Many youths or many adolescents in their communities are discriminated. Most of the albinos, those with disabilities, many of them are discriminated, and this makes them lose self-esteem. And when they lose self-esteem, it makes it very hard for them to confront a medical worker to ask for anything like condoms, because they feel like they want to be worked upon. And the other thing is the poor health services in the health centers. An adolescent may go to a health facility. They may get that courage and go to the health facility, maybe to get those services. But when they reach there, in some health centers, there are no tablets, there are no things like tablets, there are no condoms, so they can't really access them. And when they go back home, of course, they'll go live with anyone and then contract HIV. And the other thing is that lack of awareness. Fine, these adolescents will get these services, but they don't know how to use them. I very well know that even new people who are seeing me, some of you don't know how to use condoms. You don't know the proper usage of condoms. You don't know how to the steps taken to use a condom. You don't know how to use the testing kits. For example, you may get a testing kit, fine, you've gotten it and you've tested, but you don't know how to read the results. So it makes it hard for you to get to know that your partner is either positive or negative. So it is easy for you to contract HIV in such a scenario. Another issue is about the inferiority complex. You know, as adolescents, we feel like, okay, sometimes we lose the confidence that we really need to open up to the professionals. I may get I may be contracted, but I fear to go and open up to the health worker. So it suppresses me and creates depression in me. You get? And the other thing is that some parents don't bring about that kind of connection with their children. So it is really hard for the children to come and open up to the parent, yet they really need this service, and they really can't go to the health worker and report themselves. So it makes it puts their health in danger, because they really won't access anything because they can't open up to anyone.
Of what value?
This workshop has really helped me a lot. It has created awareness. Me as a person, I've got to know the rights as an adolescent, my rights to receiving these medical services. For example, I may have fear that my secret may be told to anyone, maybe by the health workers who don't comply by the health ethics, and maybe those who breach confidentiality. So in such a scenario, I can go report that healthy worker, and then that health worker is penalized. And if that health worker is penalized, all of the other health workers will learn from it, and that will stop.
Tuyingira mu guno musomo ogw'aba-adolescents okutubuulira engeri gy'okwewalamu akawuka ka mukenenya, oba ng'oluusi okalina weeyambye otya. Nali muntu ateekebeza kubanga nze wendaba mu bulamu bwange bwonna okwekebeza maze okwekebeza nga mirundi 2 mu bulamu bwange kati na myaka 16 seekebeza naye seekebeza naye olwasooka okwekebeza nengenda mu ddwaliro omusawo n'aŋŋamba ninde olwasooka n'adduka lwaki lwakutya nti we bunaajanga kituufu mbulina mbaddewo ntya nenziruka okuva mu ddwaliro naye ate n'addayo waka nekiinumiriza nenkomawo ogwokubiri we bampima omusawo n'aleeta kampimiddeko nali mbiise ku maaso nga saagala naakalabu naye nga tanaba kumpa results entuufu naye we yamala ozimpa n'aŋŋamba oli negative saakiikiriza naye mugamba kirabika tokebeedde bulungi olw'ensonga waliwo ge nali nsuze naye nga teyiye yapapa bupasi teyaŋŋamba nti oba tukozese kondomu oba tukole ki ye teyakirowoozaako kati oluvannyuma nange mu mbeera eyo we yanyiriza nange nenkiikiriza oluvannyuma nga tumaze nga nnaku nga 2 nendyoka ndowoozamu neŋŋamba gwe neebase naye ali seefu.
Kati tudde ku musomo.
Thank you so much. I'm Mwero Peter and I work with the MBALE network of young people living with HIV. The reason why this training was so important for the adolescent girls and young women, we have seen it that in Uganda we have 250 girls who get infected by HIV every single week. And if you come back to MBALE, it is girls start paying sex at the age of 15 and the numbers are high. But also if you look at the knowledge of condoms for these young girls, it is only 3.8% according to the data that MBALE district has. So this training was so important, and we want to thank our Women with a Mission, with her voice, for putting together this training, because one, it has given accurate information to the adolescent girls when it comes to HIV prevention. They have gone home with knowing how to prevent themselves from HIV through using condoms, accessing PrEP, but also the most important thing is calling out those adolescent girls and young women to go and have an HIV test. Thank you.
Do you think?
Thank you. I think the girls had some basic information on prevention, most especially on the condom. For them, they knew only one method of using a condom, but also they never knew that they're supposed to use it consistently and more often. So they never knew things like PrEP, they never had that information. But we're very grateful that today they have gone home with this information and are going to demand, they are going to ensure the uptake and utilize these services.
Now.
Okay. Thank you so much. In regard to the condoms, I know most young people have information that condoms prevent pregnancy. That's the most important thing. But also condoms, we call it double protection. It gives double protection in a way that it helps you prevent HIV as the first thing, but also it helps you to prevent pregnancy and also it helps you to prevent STI. So that's why we call it as a double protection. So young people, I've seen adolescent girls sometimes who just use a condom just because they want to prevent pregnancy. But you are telling them today that actually you need to utilize those condoms because they give you a double protection.
Area, but also the businesses. Men come in and buy, and these young girls, they don't have probably sanitary towels, they don't have money, some of them are from poor families, they admire, so they end up being praised to these business guys who come in and go out. So we identify that MBALE is one of the crucial places or in need for us to get in touch with these young girls to see if they can prevent. Because the young girls, we can talk about abstinence, but abstinence nowadays may not work. So we know that that age is sexually active. So as Women with a Mission, we identify that it's very good for us to start talking about how these adolescent girls and young women can prevent themselves from acquiring HIV than talking about abstinence because of the nature of our area as MBALE.
Okay.
And also, as we realize also that it has been the circumcision period where girls and young men go and do the ceremonies, they go and dance, so they move very many long distances and sleep sometimes there. So it is also the season that we talk about how we can prevent new infections among adolescent girls and young women.
Now,
Mbale, like also other cities, but also worldwide, we realize that the HIV new infections, but also reinfections increased due to the COVID lockdown, but also post-COVID lockdown. Remember, it was a period when the girls were not going to school, they were dormant. So the only way to make themselves busy was to engage in sexual intercourse, to be sexually active, and their bodies were sexually active. So uh, we saw that the statistics show that the HIV new infections increased among adolescent girls and young women within the COVID period. Why? Because uh, it was very hard to access SRHR services and HIV services because the Ministry of Health or the health centers were mainly concentrated in giving COVID-19 services, or even the health centers were very hard to access. So there was no way to access condoms, no PrEP, no PEP. The whole concentration was around COVID-19. So these young girls and young women ended up engaging in unprotected sex. Even when it was unprotected, they would realize the risk. They would not actually access PrEP or even PEP before they would engage in sex. So that also increased the new infections among adolescent girls because the concentration by Ministry of Health, by organizations, by by the health centers themselves, but also the distance and the lockdown of no moving from one place to another. We had to get permits from the RDC. Made it difficult that they lacked information, they couldn't access information which they could sometimes get from school. So it was very hard, and also that accelerated the increase of new infections among young women and
now,
adolescent girls. Is our appeal as women with a mission is we have left the responsibility to either the teachers who no longer have time after beating the curriculum to finish the curriculum, and also their fellow peers as leaders within the communities, as parents, as guardians. I would urge that let us join hands with civil society to ensure that the comprehensive sexuality education or HIV prevention, care and treatment education on how to prevent HIV among adolescent girls, that we take on the role, most especially the parents, that we should not leave it to the teachers or the peers because one, the peers can mislead, but as parents we have the best interest of our children, that we can do a best role. Instead of also us talking about abstinence, we can talk about abstinence, but for sure these children really engage into sex. Let us see how these children can and engage in sex, but also prevent. Let it be safer sex. How do they prevent themselves from getting HIV? So when we have, it is a multi-sectoral role as a sex stakeholders, religious leaders in church, in mosques, but also the civil societies, the parents. We have a role to take on to ensure our adolescent girls and young women are free from HIV.